to introduce you to what I call 8 breath. Have you ever been having a conversation with someone and you just couldn't wait for that conversation to be over, or you actually held your breath while they were speaking to you? Well, today I would like to speak to you and let you know how taking care of your teeth will save you pain and suffering. Now, for the past 15 years, I've worked in the dental field as a dental assistant and a dental instructor, and I've smelled some breath. Some good and some 8 breath. So you may ask, what is good dental hygiene? Good dental hygiene is brushing 2 times a day, morning and night, and flossing at least once a day to remove any bacteria that's on your teeth that will decrease the chances of any reproduction of bacteria growing on your teeth. Also, good dental hygiene is going for checkups to see your dentist or dental hygienist at least 2 times out of the year or every 6 months. So, today we're going to also talk about what happens when teeth are neglected. What is the solution and how does this impact your life? This diagram here is going to show you the progression of neglected teeth. We'll start here with plaque. Now, plaque is a sticky film that coats teeth and contains bacteria. Easily removed, but brushing and flossing must be done. This one here is going to be your calculus. Now, calculus is going to be your hardened plaque, okay? Next, comes gingivitis. Gingivitis is going to be painful and swollen gums that's caused by calculus. Next, you have your periodontal disease or gum disease. Now, this is where the gums have receded from the tooth, causing tooth loss or mobility. Now, once we're at this stage, there's no cure. There's no going back from the gum disease. It can only be maintained. So, this is a patient here that came into the office and stated that they brush their teeth daily. Well, brushing alone does not stop bacteria from growing in the mouth. This image shows a person that did not visit the dentist regularly and never flossed. A survey by the Dentist Association found that only 4 in 10 Americans actually floss every day. 20% say they never floss. Some say that they find it repulsive to floss. They would actually rather be washing dishes, cleaning the toilet, in gridlock traffic, listening to a crying baby, or listening to nails on a chalkboard. Now, the key to having good oral hygiene is flossing. Flossing is key. I have prepared a quick video for you.
You should floss your teeth once a day. Start by pulling out some dental floss from the container. Break off about 45 centimeters, 18 inches, and wind the ends around each of your index fingers. Keep winding the dental floss until you have about 5 centimeters between your fingers. Next, gently slide the floss between 2 of your teeth using a rocking motion. Be careful not to force the floss in or snap it into place. You may find it helpful to use your thumbs to gently push the floss between your teeth. When the floss reaches your gum line, curve it against one of your teeth. Next, slide the floss up and down between your tooth and gum. This helps to clean between your teeth, where a toothbrush can't reach. Be careful not to push the floss into your gum, as this can damage it. Once you start to feel some resistance on your gum, gently take the floss away from between your teeth. Next, wind the used floss around one finger and release a new section from the other finger. Making your way around your mouth, continue using these steps until you've cleaned between all of your teeth. Don't forget to floss behind your back teeth too.
Okay, so that was our clip on the proper technique on how to floss your teeth. So, the way that this affects you is that dental issues don't just stay in the mouth. When bacteria travels through your body, it goes through your bloodstream because you're swallowing. The bacteria is in your saliva and you're swallowing the bacteria. So that it travels through your bloodstream and it can go into your heart, causing heart attacks, high blood pressure, strokes, and diabetes. Okay, researchers also believe that the plaque in the mouth helps contribute to plaque buildup in the arteries, which can contribute to high blood pressure. So, to summarize everything that we spoke about today, what happens when teeth are neglected? You get gum disease, tooth mobility, and tooth loss. So what is the solution? Flossing. Flossing every day in conjunction with brushing 2 times a day. And the way that this affects you, you will possibly get high blood pressure, heart disease, strokes, or diabetes. So, the thing that I'll leave you with, if you don't remember anything that I've said in this speech, just remember that you don't have to floss your teeth, only the ones that you want to keep.